Hello and welcome to the ED training for Plaster of Paris. My name is Sarah Green, I'm the Practice Development Nurse for the Emergency Department.
Yeah, and I'm Sarah Salmon, the Assistant Practitioner, also for the Emergency Department. So we just want to just cover a few general points about the plastering. So if we start with the amount of layers, you need 6 to 8 layers for the plasters. 8 if you're going to be a little bit troublesome, and so put a few more layers on. But yeah, 6 to 8 is fine, and also 4 layers for the stirrups. The temperature of the water needs to be lukewarm. That's because if the temperature's really cold, then you get an exothermic reaction, and that when it hits the patient, the plaster touches the patient, it does the opposite and becomes really hot and to the point of burning, and you'd have to remove it. On the flip side of the coin, if the water is too hot, then you have very, very limited time to actually apply the plaster. So if you're not so 100% certain on what you're doing, you need to keep it to that lukewarm temperature. Also ensure that you remove any jewellery before you plaster. ECG tabs, you check all limbs for wounds that might need attention first. Also ensure that you ask the person who has requested you to do the plaster. Just speak to them first and understand why you're putting that plaster on. Where is the fracture? Which limb? Be good to look at an X-ray if at all possible, just to help your own learning. But yeah, documentation. Did you want to speak about?
So documentation. Whoever applies the plaster cast to the patient needs to document on Cerner that they have applied the plaster. You need to date it, time it, and make sure that if you're using somebody else's card, if the doctor's writing it, that they're writing that you applied the plaster.
Yeah, I think also the advice
and
card.
You need to be giving your patients the advice cards. It tells them all about what they need to do, how they look after it, and their use of crutches. Also, while you're there, you might as well give them our friends and family cards to fill in before they leave.
Excellent. Oh, and the DVT.
And also, so when you're doing the below knee and above knee plasters, including the Achilles ruptures and Aquinas casts, you need to be ensuring that the doctors do the VTEs on Cerner, and you can also give them one of these cards. It tells them what to look out for and how to look after their limb.
And you mentioned SaSH first time.
Oh yes. So also, just going back on when you're checking the limb for any wounds, if you're dealing with an open fracture, then it's saline soaks that you need to apply before you plaster, not betadine anymore. So a saline soak, and then you're free to put your plaster on. Thank you.
Okay, so I'm finally going to say thank you to both of you for your time and efforts today. It's been fun, it's been a bit of a laugh, and hopefully it's going to be really practical and educational.
Excellent.
Thank you.
Thank you.